Well, my colleagues have talked about access and the findings from the actuary, telling us, I think, what we expected to hear in the first place. Well, in the state of Alaska, access is beyond just a concern. It's a crisis. And it's been a crisis for a period of years. We're a rural state, we're remote, we don't have our own, we don't have any medical schools, so we're not growing our own, if you will. And unlike my colleague here from Florida, where he represents a state that has the highest per capita seniors, I represent a state that, believe it or not, is the fastest growing senior population per capita in the nation. Now, you might not have thought that. You might have thought it was going to be Nevada or Florida or someplace warm, but it's Alaska. And what's happening? We don't have providers in our state's largest city who are willing to see new Medicare patients. Anchorage, Alaska has about half the population of the state, and there are 13 providers who are willing to take new Medicare-eligible individuals. We just got confirmation on, I believe it was Monday, that one of those 13 was dropping out. She says, in view of what's happening, in view of what happens with the reimbursement, in view of what you all are discussing back here, I can't afford, within my family practice, to take on new Medicare-eligible individuals. So she's dropping out. So that puts us down to 12. This is a crisis. And so when we look at proposed legislation that does nothing to expand access, that basically says, ta-da, you now have a card, an insurance card that gives you access, but there's no providers that are willing to take you on. What have we done for these individuals? Now, we've gone beyond the CBO letters and what's coming out of CMS and look at the actuaries. We've gone to our state's think tank, if you will. It's the Institute for Social and Economic Research at the University of Alaska, and asked them, give us an analysis of the House bill, give us an analysis of what we have here on the Senate floor. And what it comes down to is nothing good for Alaska. This doesn't help us in a state where our Medicare reimbursement rates are lower than Medicaid reimbursement rates. We're only one of two states where we're in that situation. There's all kinds of unique factors, but the bottom line is this increases the premiums for individuals 10 to 13%. It crowds out those who are on Medicare. It decreases access. It increases your taxes. And at the end of the day, there's nothing good in this legislation for Alaskans. They're saying, we want to see change, we want to see reform, but this is not acceptable to us. You got to start over.